Bring in Democratic Senator Ben Ray Luján of New Mexico. Senator, I want to ask you about what John Thune just said and give you a chance to respond to it, because he said he hopes that you and the Democratic Party can now check your messaging box and do something. What do you say to him?
You know, when people are elected to power, Chris, Republicans being in charge of the Senate right now, they control the gavel, they control legislation, they control everything. They have the House with the Speaker, they have the President of the United States. And even though there was a shutdown, the Senate was here working. It's not like there was nothing happening. These conversations should have been going on. But make no mistake, that was just ridiculous spin coming from the Republican leader on the Senate floor today. If Republicans care about the American people and care about people's health care, well, then extend these tax credits, because it's not just people across the country that depend on these tax credits that are seeing sticker shock. It's everybody. I mean, including seniors. I've been receiving phone calls and messages from seniors across New Mexico who are even looking at what's happening to their Medicare plans. They're worried. A single mom from New Mexico yesterday messaged me. She said, hey, if you need to know what's going on, I just got my notice, and for me and my daughter, it's going from $900 to $1,300. So whether it's hundreds of dollars a year or thousands of dollars a year, people are seeing sticker shock. There's no reason that Republicans don't move a plan forward that says extend the tax credits. Let's continue to work to make sure that we look at other reforms. But don't forget, Chris, Republicans have voted over 70 times to get rid of the Affordable Care Act. They don't like it. They don't want it in place. Well, over the last 10 years, where's their plan? Let's come up with something here. Stop playing games with the American people. And the last thing that I would say to Leader Thune, if he was talking to me, Chris, he knows I survived a stroke 3 years ago. He knows that I was in an ICU bed. I didn't know if I was going to live one day to the next. But what I've been reminded day in and day out is when you're in those situations, the only thing you should be worried about when you're in a bed like that is about getting better, not worried about paying the bills. Am I going to be able to afford my house? Can I feed my kids? What's going to happen? People are going to have bankruptcy right in their laps again. I mean, it's awful. This is just not right.
The stakes are high. There's no disputing that for the woman you spoke to, for you, for somebody who knows what it is to have that lived experience. But when you talk about maybe coming together, I want to start with this Republican plan to give more money to Americans up front. Now, we know that isn't expected to pass today, but one of the sponsors of that bill said this morning it could maybe be a jumping off point going forward. Take a listen.
Maybe Democrats would take a deep breath. They would say Republicans are actually working with plans that are already on Obamacare, and maybe they actually have a good idea of giving the money directly to the patient as opposed to the insurance company. Would I take a call tomorrow? Hey, can we discuss this further? Absolutely. Republicans want people to be insured. We just want to meet them where they are, not assume they have $6,000 to pay for their medications, tests, and doctor's visits before the insurance kicks in.
So again, as somebody who had that real life experience, Senator, what do you make of their plan, even as a starting point for conversations that instead of giving money to insurance companies, you give it to individuals?
Look, I respect Senator Bill Cassidy of Louisiana. He's a smart man. He's a physician. Republicans talking about health care is good. I'm willing to sit down with anyone to have a real conversation about what it means to lowering costs for the American people and ensuring that when people have to dig into their pocket to get insurance, that if they go to the hospital, if they have cancer or some chronic disease, or like I did a stroke, that the plan is actually going to cover what's wrong with them. The problem with the plan that they put forward today is it still has holes in it. So look, as a jumping off point, it's not much different than what President Trump said, with the exception that the Republican plan today does nothing about extending those tax credits. It does nothing to prevent sticker shock. When President Trump told Republicans to move forward with a plan that would do something similar and extend those tax credits, it took Republicans minutes to jump all over that and reject it. And Leader Thune had other pieces of legislation that were similar to this that would actually expand tax credits, and he chose not to do it. Speaker Johnson does not even want to entertain any of the bipartisan bills that have been put on the or put up for an idea in the House that would extend the tax credits. He's just saying to hell with everybody. He doesn't really care. It's wrong. So look, let's sit down, let's talk. And Chris, look, we had a former governor in New Mexico. His name was Bruce King. He was a governor when I was born back in '72, and he was later elected to another term, but he was a cattle rancher. And Bruce would always say, lock them up in a barn and don't let them out till they come up with an idea. It seems like that needs to happen now. And I've been joking about this, but I'm serious about it too. There's a big hole in the White House. It's easy to get in there. The president should bring everyone in here, bring the smart people together. Let's get this solved. Stop playing games with the American people.
Can we look at a big picture for a moment? No matter what side you're on the ACA, the fact is Americans spend roughly twice as much on inpatient and outpatient care as people in comparable countries. That's according to the Kaiser Family Foundation. So when Republicans say we can't just extend ACA subsidies, we have to do something to bring down costs, do they have a point?
I'm all about bringing down costs, Chris. The American people are paying way too much with health insurance companies. I say we should hold health insurance companies accountable. This notion that doctors can't make decisions about how to treat a patient because they need some bean counter somewhere that works for an insurance company to say if you should or shouldn't get it. I trust my doctor. I don't trust that insurance company. So I'm all about reform and working on this as well. And look, if there's anything that the American people learned during COVID, if you think you're sick, you should get a test. And if you are sick, you should be able to get help. And by the way, when we look at Medicare itself, why is it that people still have to pay out of pocket when it comes to hearing aids or getting dental work or even getting their glasses done? That should all be included. If we're serious about making healthcare more affordable in America, there's a lot of ideas. Let's get to work, let's get it done, and let's make sure we're putting money back in the pockets of the American people as opposed to making these insurance companies richer and richer and richer and then leaving people to pay these ridiculous healthcare bills when they're just sick and they're just trying to get better. There's a better way to get there. I'm open to have these conversations. But the nonsense that my Republican colleagues seem to be peddling right now, come on, man. The American people are smarter than this. Don't forget about me when my Republican colleagues had the courage and the strength and the compassion to send me messages and notes and phone calls to say, Ben Ray, please get better. You can beat this stroke. I want to talk to those colleagues. I want to talk to them because I know they cared about me. I believe they care about their constituents. So let's just make it work for everybody. Let's make this better. I'm on board.
Senator Ben Ray Luján, thank you so much for coming again on the program. We appreciate it.